Injuries to the hamstring muscle group likely happen when the hamstrings are actively lengthening, and so injury can occur during acceleration and high-speed running, both of which impose different demands on the hamstrings. During acceleration, the horizontal component of ground reaction force is maximised in order to help propel the centre of mass forward. Here, large hip extensor torques are generated, with the biceps femoris long head being the primary hip extensor. During high-speed running, the hamstrings actively lengthen to decelerate the forward swinging leg, with force production of the hamstrings peaking during the swing phase. The stance phase also exposes the hamstrings to high amounts of stress. This is because the ground reaction force occurring during early stance generates large knee extension and hip flexion torques. This results in lengthening of the hamstrings, and so large forces must be applied to counteract this ground reaction force. And because the total length change and velocity of movement in high-speed running is greater than during acceleration, it's likely this imposes greater strain on the hamstrings. Regarding running mechanics, after a hamstring injury, for athletes who have experienced a hamstring injury, they typically demonstrate increased anterior pelvic tilt, greater hip flexion, and greater thoracic lateral flexion in comparison to athletes who haven't experienced a hamstring injury. These changes in kinematics, which occur during the late swing phase of the gait cycle, could indicate an inability to resist over-lengthening, placing the hamstrings in a longer position during running, and therefore increasing strain. Following a hamstring strain injury, many athletes exhibit an eccentric strength deficit, greater neural inhibition, and decreased bicep femoris long head activation during the late swing phase at high speeds. Deficits in hamstring torque production during the swing phase may result in greater strain on the muscle and lower levels of horizontal force production. Interestingly, lower levels of horizontal force production during sprinting have been found to be related to future risk of hamstring strain injury. As a result, strengthening the hamstrings plays a key role during the return to play phase of the rehabilitation continuum. In the article published in the International Journal of Sports Physiology and Performance, titled Hamstring Injuries, From the Clinic to the Field, Jordi and colleagues, in their narrative review, discuss exercise transfer for exercises that are often used in the hamstring rehabilitation process, including the Nordic hamstring curl, flywheel training, and lumbopelvic exercises, and their ability to improve eccentric knee flexor torque during running, and what type of research is needed going forward to improve hamstring rehabilitation. This presentation, brought to you by Talking Sports Science, will provide a summary of Jordi and colleagues' work. Firstly, of the exercises commonly investigated in the literature, there is only evidence supporting eccentric exercises, specifically the Nordic hamstring curl, for improving torque production of the hamstrings during running gait. Regarding the Nordic hamstring curl, which is the most researched hamstring exercise, initial studies used a 10-week program progressing from 2 sets of 5 repetitions once per week to 3 sets of 8 to 12 repetitions 3 times per week. However, beneficial adaptations have been found to occur training once per week using 2 sets of 4 repetitions over a 4 to 6 week period. The Nordic hamstring curl potentially reduces injury risk by increasing eccentric knee flexor strength and bicep femoris long head fascicle length, which improves the ability of the muscle to resist over-lengthening during the swing phase of gait. Although inconsistent with principles of transfer, the majority of training studies using the Nordic hamstring curl demonstrate improvements in sprint performance over 5 to 30 meters and increases in eccentric hamstring strength of approximately between 10 to 15%. Following 4 to 6 weeks of training. Only one study has investigated the transfer of Nordic hamstring curl training to swing phase mechanics during sprinting. Following training, increases in eccentric hamstring moment recorded during Nordics were related to increased knee and hip joint moments during the terminal swing phase of gait, therefore indicating adaptations occurring due to the Nordic hamstring curl have a positive transfer on swing phase kinematics, which likely improves the hamstring's ability to produce torque at long muscle lengths. In contrast to the Nordic hamstring curl, flywheel training is more consistent with principles of transfer. Flywheel training involves an athlete creating inertial torque by pulling a cable attached to a flywheel during the concentric phase of the exercise, which individuals then must resist as it pulls against them during the eccentric portion of the movement. Flywheel devices are also effective for applying eccentric overload during exercises in lengthened positions, where the hamstrings are likely to sustain an injury during sprinting. The contraction velocity can be increased or decreased depending on the performer's intent, the characteristics of the device used, and the types of exercises selected. Therefore, flywheel training can be considered an adaptable resistance modality to obtain hamstring adaptations. Studies involving flywheel training have reported increases in braking and propulsive forces during a change of direction task, faster changes of direction performance, and faster 40-meter sprint times. Lower hamstring injury rates have been reported in football players performing flywheel training compared with controls in one small-scale study involving 30 football players. However, no studies to date have investigated the biomechanical mechanisms behind these findings. Therefore, more studies are needed to determine the effect of flywheel training on injury incidence and hamstring function during sprinting. Moving on to lumbopelvic training, which involves employing a multimodal intervention to improve an athlete's ability to minimize disruptions to pelvic position during running gait. Here is an example of a multimodal training program from the study by Mendegukia et al. 2022, which involved 3 weekly sessions integrating coaching, strength and conditioning, and physical therapy approaches, where 7 healthy amateur athletes in the intervention group completed a sprint test with 3-dimensional kinematic measurements performed before and after the 6 weeks of training. This type of training resulted in reduced hip extension of the rear thigh during toe-off, reduced anterior pelvic tilt by approximately 5 degrees during swing, as well as less hip flexion during swing. These changes in kinematics theoretically reduce the strain imposed upon hamstrings during running. Although this study did not report changes in knee moments following the training intervention, the observed changes in the pelvic position would result in smaller hamstring length changes during sprinting, imposing less strain upon the muscle group. While this training approach can result in changes in running performance, there are no randomized controlled trials demonstrating improvements in lumbopelvic control result in reduced risk of future injury. As a result, if the aim of these exercises is to improve the capacity of the hamstring muscle group to produce torque during active lengthening or limit over-lengthening while running, lumbopelvic exercises cannot be prescribed with the same level of confidence as eccentric exercise. To improve performance and reduce the risk of hamstring injury during sprinting, rehabilitation exercises should aim to improve the eccentric knee flexor torque produced during terminal swing. Improving this capacity will allow hamstring muscle fibers to resist over-lengthening and limit the risk of strain injury. However, going forward, in order to improve hamstring rehabilitation and determine whether principles of transfer must be adhered to for an exercise to be effective, prospective training studies assessing running kinematics are required to determine the effects of different exercises on running gait and whether this reduces the risk of injury. Until such evidence and randomized controlled trials investigating the effects of various training interventions on injury rates and performance are available, it's recommended that practitioners should prioritize the use of eccentric exercises, such as the Nordic hamstring curl, for hamstring rehabilitation, as there is evidence showing that these exercises improve performance and reduce injury rates. And that concludes this presentation. As always, I recommend you go and check out the full article by Jordi and colleagues to gain a deeper insight into the research surrounding current approaches to hamstring training, as well as their ability to transfer to improve running gait performance. The link to the article is in the description. Thanks for listening, folks. See you next time.